Welcome to the TB Education Training. This presentation was created and provided by the Centers for Disease Control, or CDC, as part of an ongoing public health campaign on TB. It serves as an introduction on the basics of tuberculosis disease. Here are the topics that we will cover as we go through the training. Let's jump in by answering this question. What is tuberculosis? TB is a disease caused by a bacteria called Mycobacterium tuberculosis. It is a disease that spreads from person to person through the air. When a person breathes in TB germs, the germs can settle in the lungs and begin to grow. From there, the germs can move through the blood to other parts of the body, like the kidney, spine, or brain. When TB germs settle in the lungs, it's called pulmonary TB. When it settles in other organs, it's extrapulmonary TB. TB is not a disease of the past. It is still actively being transmitted and contracted. TB is preventable and treatable, but remains one of the world's deadliest infectious disease killers. After decreasing considerably in 2020, TB cases have been increasing since 2021, with 2023 reporting the highest number of cases since 2013. How is TB spread? TB is spread through the air. The TB germs are put into the air when a person with TB disease of the lungs or throat coughs, sings, or speaks. People nearby may breathe in these germs and become infected. The best way to stop TB spread is to identify people who have TB, isolate those who are contagious, or provide treatment as soon as possible to anyone who is contagious. People with TB disease are most likely to spread it to people they spend time with every day, including family members, friends, co-workers, or schoolmates. TB is not spread through shaking hands or sharing utensils. TB exists in two states: inactive, also called latent TB infection, or TB disease. TB germs can live in your body without making you sick. This is called inactive TB or latent TB infection. People with inactive TB have TB germs in their bodies but do not have TB disease and cannot spread the infection to other people. TB germs become active if the immune system can't stop them from growing. When TB germs are active, that is, multiplying in your body, this is called the TB disease. This table shows a side-by-side comparison of inactive TB and TB disease. A person with inactive TB has a small amount of TB germs. They cannot spread TB to others. They are asymptomatic. They usually have a positive TB skin test or blood test, have a normal chest x-ray, and need treatment to prevent TB disease. A person with TB disease has a large amount of active TB germs. They can spread TB to others, and they feel multiple symptoms. They usually have a positive TB skin test or blood test and may have an abnormal chest x-ray. A person with the disease still needs treatment to live. More than 80% of people who get sick with active TB disease in the United States each year get sick from untreated inactive TB. Many people who have inactive TB never develop TB disease. Some people develop TB disease soon after becoming infected. Other people may get sick years later when their immune system becomes weak for another reason. While not everyone with inactive TB will develop TB disease, 1 in 10 people will develop TB disease over their lifetime if not treated. The progression from inactive TB to TB disease may occur at any time, but it is most common within the first 2 years of infection. This illustration helps to summarize TB disease and inactive TB in the United States. TB disease is just the tip of the iceberg that is visible above water. TB disease can be seen because of the active germs in a person's body and the symptoms they experience. People with TB disease can spread TB to others. However, the larger part of the iceberg that is hidden underwater represents inactive TB. Like the iceberg, inactive TB can be easily hidden because TB germs are inactive and people with inactive TB germs do not feel sick. Many people with inactive TB do not know they are infected with TB. There are up to 13 million people in the US with inactive TB. Without treatment for inactive TB, they could develop TB disease. These are the possible TB disease symptoms: night sweats, weakness or fatigue, cough lasting longer than 3 weeks, fever, weight loss, pain in the chest, chills, no appetite, or coughing up blood or sputum. Risk factors. People at higher risk of contracting TB include employees of high-risk congregate settings, healthcare workers who serve patients with TB disease, populations defined locally as having an increased incidence of inactive TB infection or TB disease, including medically underserved populations, low-income populations, or people who use drugs or alcohol. Infants, children, and adolescents exposed to adults who are at risk of inactive TB infection or TB disease. TB disease in the United States is most common among people who were born in countries with high rates of TB. Demographic characteristics for TB patients have remained consistent over the last several years. For example, since 2010, the majority of reported TB disease cases in the US occur among non-US born persons. The most common countries of birth among non-US born TB patients remained fairly consistent over the last several years. This slide shows data from 2023, with Mexico being the most frequently reported country of birth, followed by the Philippines, then India, Vietnam, and China. Other countries represented 52% of cases. 2023, Hispanic or Latino persons represented the largest proportion of TB patients, followed by non-Hispanic Asian persons, non-Hispanic Black or African American persons, and non-Hispanic white persons. While not everyone with inactive TB will develop TB disease, about 1 in 10 people will develop TB disease over their lifetime if not treated. Progression from untreated inactive TB to TB disease is estimated to account for more than 80% of US TB cases. People at higher risk of developing TB disease generally fall into 2 categories: those who have been recently infected with TB germs, and those with medical conditions that can weaken your immune system. Medical conditions that can weaken your immune system include HIV infection, diabetes, head or neck cancer, severe kidney disease, substance abuse, someone who has done an organ transplant, or if you are being treated for rheumatoid arthritis or Crohn's disease, silicosis, or low body weight. Babies and young children are also at risk because they often have weak immune systems. TB testing. Healthcare providers are encouraged to use newer TB blood tests to screen for TB infection. There are two types of TB tests. The TB blood test is called the quantiferon gold test, and the TB skin test is called the Monta tuberculin. A positive TB skin test or blood test only tells that a person has been infected with TB germs. It does not tell whether the person has inactive TB or has progressed to TB disease. Other tests, such as chest x rays and a sample of sputum, are needed to see whether the person has full blown TB disease. Generally, it is not recommended to test a person with both a skin test and a blood test. Reminder, TB blood test is called the quantiferon gold test. TB blood tests measure a person's immune reactivity to TB germs. Results from blood tests can be read as positive or negative. If the result is not clearly positive or negative, the test can be repeated. Positive may equal inactive TB likely. Negative may include inactive TB unlikely but cannot be excluded, especially if the person has signs and symptoms consistent with TB disease, or the person has a high risk of developing TB disease once infected with TB germs. Blood tests are the preferred test for people who have received the TB vaccine. This is how a skin test is administered and read. The image on the left shows a TB skin test being administered into a patient's arm. The image on the right shows the test being read by measuring the reaction at the test injection site. A skin test is not a vaccine for TB disease. A TB skin test requires 2 visits with a healthcare provider. On the first visit, the skin test is placed by injecting a small amount of fluid called tuberculin into the skin on the lower part of the arm. The skin will react if there are TB germs in the body. A person given the tuberculin skin test must return within 48 to 72 hours to have a trained healthcare worker look for a reaction on the arm. The results depend on the size of the raised arm area where the skin reacted. The results depend on the size of the raised hard area or swelling. A positive skin test means the person's body is infected with TB germs. Additional tests are needed to determine if the person has inactive TB or TB disease. Negative skin test means the person's body did not react to the test and that inactive TB or TB disease is not likely. BCG is a vaccine for preventing TB disease. It is a weak form of bacteria that is closely related to the germs that cause TB. This vaccine is not widely used in the United States, but it is often given to infants and small children in other countries where TB disease is common. BCG vaccine does not always protect people from getting TB, and protection goes away as people get older. Many people born outside of the United States have received the TB vaccine. The TB vaccine may cause a false positive reaction to the TB skin test. which can complicate decisions about treatment. The presence or size of a TB skin test reaction in those who have been vaccinated with BCG does not predict whether the vaccine will provide protection against the TB disease. TB blood tests, unlike TB skin tests, are not affected by prior TB vaccination and are easier to interpret in people who have received the TB vaccine. Treatment. TB can be cured whether it is inactive or active. People with TB disease feel sick and can spread TB germs, especially to people they spend time with every day. When an individual tests positive for TB, follow-up testing is conducted to confirm if the infection is inactive or if that person has the disease. A confirmation of TB disease will require at least 4 to 6 months of medication, X-rays, lab tests, follow-up, and contact tracing. Conducting contact tracing is a priority for tuberculosis programs in the United States. The goal of contact investigations or contact tracing is to successfully stop the spread of TB and prevent future cases and outbreaks of the TB disease. People with inactive TB do not have symptoms and they cannot spread TB to others. However, if inactive TB germs become active in the body and multiply, the person will go from having inactive TB to being sick with TB disease. For this reason, people with inactive TB should be treated to prevent them from developing TB disease. Treatment for inactive TB is essentially to control TB in the United States because it substantially reduces the risk that inactive TB will progress to TB disease. Treating inactive TB is effective in preventing TB disease. There are several options for the treatment of inactive TB. There have been advances in shortening the length of inactive TB infection treatment from 6 to 9 months to 3 to 4 months. Short course inactive TB treatments are effective, safe, and have higher completion rates than longer treatments. Shorter regimens help people finish treatment. It is very important that people who have TB disease are treated, take the medicine exactly as prescribed, and finish all medicine. If they stop taking the medicine too soon, they can become sick again. If they do not take the medicine correctly, the TB germs that are still alive may become resistant to those drugs. Resistant means the drugs can no longer kill the TB germs. Drug-resistant TB can occur when the drugs used to treat TB are misused or mismanaged. Examples of misuse or mismanagement include when people do not complete a full course of TB treatment, healthcare providers prescribe the wrong treatment, or drugs for proper treatment are not available. Directly Observed Therapy or DOT is a support program for the successful completion of TB treatment. Directly observed therapy for tuberculosis treatment involves observing a patient ingest medication, monitoring the patient for side effects, and providing support. DOT can reduce the development of drug resistance, treatment failure, or relapse after the end of treatment. DOT can be given anywhere the patient and healthcare worker agrees upon, providing the time and location are convenient and safe. Another support for the successful completion of TB treatment is Video Directly Observed Therapy or VDOT. VDOT allows persons undergoing TB treatment the opportunity to use video-enabled phones, tablets, or computers to remotely interact with healthcare workers in real time or through recorded videos. TB elimination. 2023 saw a 15.6% increase in cases compared with 2022. There were 9,633 TB cases in the United States in 2023. To reverse recent increases in TB and reach the goal of TB elimination in the United States, enhanced strategies to diagnose and treat inactive TB and TB disease are needed. The TB elimination threshold is less than 1 per 1 million population, which is approximately 335 cases per year for the current US population. We can all agree that it's time to end TB, meaning it's time to test for and treat inactive TB. It's time to strengthen TB education and awareness among healthcare providers. It's time to find, cure, and prevent all forms of TB in the United States and around the world. It's time to end stigma, and it's time to speak up. The key to diagnosing TB is for clinicians to think TB when they see a patient with signs and symptoms of TB disease. Because TB is not as common as it was years ago in the United States, many clinicians do not consider the possibility of TB when evaluating patients who have symptoms of TB. When this happens, the diagnosis of TB may be delayed or even overlooked, and the patient will remain ill and possibly infectious. TB control and prevention is a complex undertaking that requires the collaborative efforts of a broad range of individuals, organizations, and institutions in both the public and private health sectors. State and local health departments have the primary responsibility for preventing and controlling TB. This includes the essential role of planning, coordinating, and evaluating program activities. Healthcare workers in doctors' offices and hospitals, community health centers, and academic institutions implement TB control efforts such as testing, treating, and reporting to health departments. CDC's Think, Test, Treat TB campaign aims to reach those most at risk for latent TB infection and their healthcare providers to encourage TB testing and get closer to the elimination of TB. Think, Test, Treat is the first national multilingual communications campaign to increase testing for inactive TB, a major health disparity among Asian Americans. Here is a resource guide for information and support regarding TB disease. You have now completed your yearly TB education training.